NLN NEX Comprehension questions. Question 1. Which inference is best supported by the passage? A community clinic added evening hours, and attendance increased among working adults in this mean score item. Option A. Working adults avoided the clinic more often. Option B. Expanded hours improved access for people who could not visit during the day. Option C. Evening visits made all care free. Option D. The clinic stopped serving adults. The correct answer is option. The passage links evening hours with increased attendance among working adults. Working adults avoided the clinic more often is not supported by the passage. Evening visits made all carefree is not supported by the passage, and the clinic stopped serving adults is not supported by the passage. Question 2. During a quick NEX review of a probability set item, which inference is best supported by the passage? A student reread difficult paragraphs and wrote a one-sentence summary after each one. Option A. Skipping hard paragraphs saves time. Option B. A summaries should replace reading. Option C. Active review can improve understanding of complex text. Option D. Only long notes improve reading. The correct answer is option. The student uses summarizing to check meaning after reading. Skipping hard paragraphs saves time is not supported by the passage. Summaries should replace reading is not supported by the passage, and only long notes improve reading is not supported by the passage. Question 3. After checking the choices in a test strategy item, which inference is best supported by the passage? A hospital placed hand sanitizer near every doorway, and staff use rows during shift changes. Option A. Making supplies easy to reach can support safer habits. Option B. Safety improves only through written rules. Option C. Doorways cause infections by themselves. Option D. Staff should avoid sanitizer during shifts. The correct answer is option. The change made the desired behavior easier and more visible. Safety improves only through written rules is not supported by the passage. Doorways cause infections by themselves is not supported by the passage, and staff should avoid sanitizer during shifts is not supported by the passage. Question 4. If a main idea stem gives one clear clue, which inference is best supported by the passage? A patient education sheet used short sentences, headings, and pictures. Option A. Headings reduce the value of information. Option B. Long paragraphs are best for patient teaching. Option C. Clear formatting helps readers understand health information. Option D. Pictures make written instructions unnecessary. The correct answer is option. The sheet is designed to improve readability and comprehension. Headings reduce the value of information is not supported by the passage. Long paragraphs are best for patient teaching is not supported by the passage, and pictures make written instructions unnecessary is not supported by the passage. Question 5. When time is limited on an inference clue question, which inference is best supported by the passage? A researcher noticed that larger sample sizes produced more stable survey results. Option A. More data can make results more reliable. Option B. Small samples always prove a theory. Option C. Large samples remove every error. Option D. Surveys do not need participants. The correct answer is option. The passage emphasizes stability from larger samples. Small samples always prove a theory is not supported by the passage. Large samples remove every error is not supported by the passage, and surveys do not need participants is not supported by the passage. Question 6. Given the information in an author purpose item, which inference is best supported by the passage? A nurse calmly repeated discharge instructions and asked the patient to explain them back. Option A. Discharge instructions should be avoided. Option B. Teach back checks whether the patient understands instructions. Option C. Patients should memorize medical terms first. Option D. Repeating words proves the nurse is confused. The correct answer is option. Having the patient explain instructions confirms understanding. Discharge instructions should be avoided is not supported by the passage. Patients should memorize medical terms first is not supported by the passage, and repeating words proves the nurse is confused is not supported by the passage. Question 7. Suppose a similar summary task item appears on test day, which inference is best supported by the passage? A graph showed water intake rising each week after reminders were added to a wellness app. Option A. The app removed the need for habits. Option B. A water intake decreased every week. Option C. Reminders may have encouraged more consistent water intake. Option D. The graph proves reminders cure illness. The correct answer is option. The passage connects reminders with increased intake. The app removed the need for habits, is not supported by the passage. Water intake decreased every week, is not supported by the passage. And the graph proves reminders cure illness, is not supported by the passage. Question 8. While working through a timed sentence correction set, which inference is best supported by the passage, a paragraph compares online classes with classroom learning by discussing flexibility, cost, and interaction. Option A. The paragraph is organized by comparison and contrast. Option B. The paragraph lists only causes. Option C. The paragraph tells a fictional story. Option D. The paragraph gives a step-by-step procedure. The correct answer is option. The paragraph examines similarities and differences between two learning formats. The paragraph lists only causes, is not supported by the passage. The paragraph tells a fictional story, is not supported by the passage. And the paragraph gives a step-by-step procedure, is not supported by the passage. Question 9. Before choosing an answer in a punctuation review item, which inference is best supported by the passage, a volunteer program grew after former patients shared personal stories at orientation. Option A. Volunteer programs grow without communication. Option B. Personal stories can motivate people to participate. Option C. Former patients stopped the program. Option D. Orientation should never include stories. The correct answer is option. The passage shows participation increased after meaningful stories were shared. Volunteer programs grow without communication, is not supported by the passage. Former patients stopped the program, is not supported by the passage. And orientation should never include stories, is not supported by the passage. Question 10. A student sees this pronoun agreement idea on a NEX review, which inference is best supported by the passage. A study guide placed key formulas in boxes and practice questions beside each formula. Option A. Boxes make formulas incorrect. Option B. Practice questions replace all instruction. Option C. Formulas should never be practiced. Option D. Pairing formulas with practice helps students apply concepts. The correct answer is option. The guide connects a rule with immediate application. Boxes make formulas incorrect, is not supported by the passage. Practice questions replace all instruction, is not supported by the passage. And formulas should never be practiced, is not supported by the passage. Question 11. One parallel structure practice problem tests this skill, which inference is best supported by the passage. A patient reports dizziness after standing quickly from a chair. Option A. Dizziness proves a broken bone. Option B. Chairs cause infections. Option C. The symptom may be related to a sudden blood pressure change. Option D. Standing always improves circulation. The correct answer is option. Dizziness on standing is commonly linked to blood pressure shifts. Dizziness proves a broken bone, is not supported by the passage. Chairs cause infections, is not supported by the passage. And standing always improves circulation, is not supported by the passage. Question 12. Several choices look tempting in an active voice item, which inference is best supported by the passage. A passage describes how sleep, nutrition, and review schedules all affect test readiness. Option A. Test readiness is influenced by several habits. Option B. Nutrition prevents all test mistakes. Option C. Schedules do not matter. Option D. Only sleep affects learning. The correct answer is option. The passage presents multiple factors that support readiness. Nutrition prevents all test mistakes, is not supported by the passage. Schedules do not matter, is not supported by the passage. And only sleep affects learning, is not supported by the passage. Question 13. For this capitalization check nursing entrance question, which inference is best supported by the passage, a lab note says the control group received no caffeine while the experimental group received caffeine. Option A. Caffeine is the dependent variable. Option B. The experimental group is ignored. Option C. The control group receives the treatment first. Option D. The control group provides a comparison for the treatment. The correct answer is option. A control group helps show whether caffeine made a difference. Caffeine is the dependent variable, is not supported by the passage. The experimental group is ignored, is not supported by the passage. And the control group receives the treatment first, is not supported by the passage. Question 14. In a short clinical scenario practice STEM, Which inference is best supported by the passage? A school added quiet study rooms, and students reported fewer distractions. Option A, distractions are always helpful. Option B, reducing distractions can improve study conditions. Option C, quiet rooms increase noise. Option D, students no longer needed to study. The correct answer is option. The result directly connects quiet rooms to fewer distractions. Distractions are always helpful is not supported by the passage, quiet rooms increase noise is not supported by the passage, and students no longer needed to study is not supported by the passage. Question 15. Among the choices in a community clinic item, which inference is best supported by the passage? A nurse explains that antibiotics treat bacteria but not viral colds. Option A. The key point is that treatments must match the cause of illness. Option B, viruses and bacteria are identical. Option C, antibiotics treat every infection. Option D, colds always require antibiotics. The correct answer is option. The explanation distinguishes bacterial and viral causes. Viruses and bacteria are identical is not supported by the passage, antibiotics treat every infection is not supported by the passage, and colds always require antibiotics is not supported by the passage. Question 16. Using the facts in a student survey question, which inference is best supported by the passage? A chart shows pulse rates before and after exercise, with higher rates after activity. Option A, pulse is unrelated to activity. Option B, charts cannot show change. Option C, exercise can increase heart rate. Option D, exercise always lowers pulse. The correct answer is option. The before and after pattern shows increased heart rate after exercise. Pulse is unrelated to activity is not supported by the passage, charts cannot show change is not supported by the passage, and exercise always lowers pulse is not supported by the passage. Question 17. Based on the clue in a wellness app item, which inference is best supported by the passage? A paragraph begins with a claim, gives two examples, and ends by restating the claim. Option A. The claim is hidden in a footnote. Option B. The structure supports the main idea with examples. Option C. The paragraph has no conclusion. Option D. Examples are unrelated to claims. The correct answer is option. The organization uses evidence to reinforce the point. The claim is hidden in a footnote, is not supported by the passage, the paragraph has no conclusion, is not supported by the passage, and examples are unrelated to claims, is not supported by the passage. Question 18. Consider this high-yield practice timer concept, which inference is best supported by the passage? A patient skips breakfast before a long class and later has trouble concentrating. Option A, classes prevent hunger. Option B, concentration is unrelated to food. Option C, nutrition may affect attention and learning. Option D, skipping breakfast always improves focus. The correct answer is option. The passage connects lack of food with difficulty focusing. Classes prevent hunger is not supported by the passage, concentration is unrelated to food is not supported by the passage, and skipping breakfast always improves focus is not supported by the passage. Question 19. Near the end of an exam readiness review session, which inference is best supported by the passage? A report says infection rates fell after staff completed a hand hygiene refresher. Option A, training may have improved compliance with hygiene practices. Option B, training increased infection rates. Option C, hand hygiene cannot affect infection. Option D, the refresher removed all risk permanently. The correct answer is option. The sequence suggests training supported better hygiene behavior. Training increased infection rates is not supported by the passage, hand hygiene cannot affect infection is not supported by the passage, and the refresher removed all risk permanently is not supported by the passage. Question 20. Across similar quick review nursing entrance questions, which inference is best supported by the passage? A tutor tells a student to eliminate choices that contradict the passage before guessing. Option A, guessing is always better than reading. Option B, all choices are equally likely after reading. Option C, contradictory choices should be selected first. Option D, eliminating impossible choices can improve test accuracy. The correct answer is option. The strategy reduces the number of plausible answers. Guessing is always better than reading is not supported by the passage. All choices are equally likely after reading is not supported by the passage, and contradictory choices should be selected first is not supported by the passage. Question 21. Since only one choice fits the hard question clue, which inference is best supported by the passage? A short article explains that dehydration can cause fatigue, headache, and dark urine. Option A. The article is mainly explaining signs of dehydration. Option B. The article compares hospital departments. Option C. The article teaches grammar rules. Option D. The article reviews bone injuries. The correct answer is option. All listed details point to symptoms of dehydration. The article compares hospital departments is not supported by the passage. The article teaches grammar rules is not supported by the passage, and the article reviews bone injuries is not supported by the passage. Question 22. From the information in a easy question item, which inference is best supported by the passage? A paragraph states that teamwork improves safety because it helps staff catch errors early. Option A. Communication is unrelated to safety. Option B. Teamwork removes the need for training. Option C. Teamwork can reduce mistakes by improving communication. Option D. Errors are always intentional. The correct answer is option. The passage explains how teamwork supports safety. Communication is unrelated to safety is not supported by the passage. Teamwork removes the need for training is not supported by the passage, and errors are always intentional is not supported by the passage. Question 23. At a testing desk during a mock test review, which inference is best supported by the passage? A student highlights every sentence and later cannot identify the main point. Option A. Highlighting guarantees understanding. Option B. Main ideas should never be located. Option C. Every sentence is always equally important. Option D. Highlighting too much can make key ideas harder to find. The correct answer is option. The problem comes from failing to distinguish key information from details. Highlighting guarantees understanding is not supported by the passage. Main ideas should never be located is not supported by the passage, and every sentence is always equally important is not supported by the passage. Question 24. Inside a diagnostic set science or skills item, which inference is best supported by the passage? A clinic sends appointment reminders, and missed visits decline. Option A. Appointments no longer need scheduling. Option B. Patients cannot benefit from reminders. Option C. Reminders caused more missed visits. Option D. Reminders can help patients remember appointments. The correct answer is option. The decline in missed visits supports the role of reminders. Appointments no longer need scheduling is not supported by the passage. Patients cannot benefit from reminders is not supported by the passage, and reminders caused more missed visits is not supported by the passage. Question 25. Through careful reading of a final review stem, which inference is best supported by the passage? A science passage explains that enzymes work best within certain temperature ranges. Option A. Enzymes are not involved in reactions. Option B. All enzymes work best when frozen. Option C. Enzyme activity depends on conditions such as temperature. Option D. A temperature never affects proteins. The correct answer is option. The passage focuses on how conditions influence enzyme function. Enzymes are not involved in reactions is not supported by the passage. All enzymes work best when frozen is not supported by the passage, and temperature never affects proteins is not supported by the passage.